Good morning, Mr. Johnson. I'm Sarah, the respiratory physiotherapist. I understand you've been admitted with breathing difficulties. Can you tell me how you've been feeling?
I've been terrible. Can't catch my breath. And when I cough, it feels like someone's stabbing me in the chest.
I'm sorry to hear that. When did these symptoms start getting worse?
About 4 days ago. Started with just feeling more tired than usual. Then the cough got much worse.
Are you bringing up any sputum when you cough? If so, what colour is it?
Yes, lots of thick green stuff. Much more than usual. And it's horrible to get up.
On a scale of 1 to 10, how would you rate your breathlessness right now, with 10 being the worst you can imagine?
About an 8. I can barely walk to the bathroom without getting completely out of breath.
What's your normal level of activity? Do you use any walking aids?
I normally can walk about 100 meters with my walking stick before I need to stop. Now, I can barely manage 10 meters.
Are you using your inhalers more often than usual?
Yes, I'm using my blue inhaler every hour, but it's not helping much.
Let me listen to your chest now. I'll need you to take deep breaths through your mouth. I can hear wheeze throughout both lungs and some coarse crackles at the bases. There are also some areas where the air entry sounds reduced. I'm going to gently feel around your chest and back to check for any tenderness or changes in chest movement.
Ow, that's really tender on the right side when you press there.
I notice your chest isn't expanding as much on the right side when you breathe in. Can you cough for me? I want to assess how effective your cough is.
It hurts so much when I cough, I try to avoid it. When I do cough, I can't seem to bring much up.
Let me check your oxygen levels and take some other measurements. Your oxygen saturation is 88% on room air, heart rate is 110, and blood pressure is 145/90. You also feel quite warm. Mr. Johnson, I'd like to explain what I found during my assessment. Is that okay with you?
Yes, please. I'd like to know what's happening to me.
The good news is that we know what's causing your symptoms, and we can help you feel better. You have what we call a chest infection on top of your usual COPD. Think of it like having a cold that's settled in your lungs.
So it's not just my COPD getting worse.
That's right. Your COPD has flared up because of this infection. It's like when you have a cut and it gets infected, everything becomes more inflamed and sore. The infection is making your airways more swollen and producing more mucus than usual.
That makes sense. Is that why I'm bringing up all this horrible green stuff?
Exactly. The green colour tells us your body is fighting the infection. It's actually a good sign that your immune system is working, but we need to help you get it out of your lungs so you can breathe easier.
Will I get better? I'm quite scared about how breathless I've become.
I understand you're frightened. It's completely normal to feel scared when you can't breathe properly. The important thing is that this type of chest infection usually responds well to treatment. Most people with your condition do get back to their normal level of breathing, though it may take a week or two. Let me explain what I think the main problems are that we need to work on together. Is that all right?
Yes, I'd like to understand what we're dealing with.
The biggest problem right now is that you're not getting enough oxygen into your blood. That's why you're so breathless. We'll put you on some oxygen through a mask to help with that immediately.
Will that help me feel less breathless straight away?
It should help within minutes. The second main problem is that all this thick mucus is stuck in your lungs, particularly on the right side where the infection is worst. It's like having a blocked drain. We need to help clear it out.
How do we do that? My cough isn't working very well.
That's the third problem. The pain when you cough is stopping you from clearing your chest effectively. We have techniques that can help you cough more comfortably and effectively. Would you like me to show you?
Yes, please. Anything that might help.
Now, thinking about what's most important to you right now, what would you most like to achieve while you're in hospital?
I just want to be able to breathe without feeling like I'm drowning. And I'd like to be able to walk to the bathroom without my wife having to help me.
Those are really important goals. So, if I understand correctly, you want to breathe more easily and get back to managing your personal care independently?
Yes, that's right. I hate feeling so helpless.
I completely understand that feeling. Let's work together on some goals. How about we aim to get your breathing easier within the next day or two, and then work on getting you walking to the bathroom independently within the week?
That sounds reasonable. What do I need to do?
Let me start by showing you some positions that will make your breathing much easier. Right now, you're working very hard to breathe, and we can help reduce that effort.
I have noticed I feel a bit better when I lean forward.
That's very clever of you. Leaning forward actually helps your breathing muscles work more efficiently. It's like the difference between trying to lift something heavy with your arms by your side versus bracing yourself against a table. When you lean forward like this, with your arms resting on a table or your knees, it helps your diaphragm, that's your main breathing muscle, work more easily. It also helps open up the airways in your lungs.
So I should sit like this more often?
Absolutely. This position uses less energy for breathing, which means you'll feel less tired. When you're lying in bed, try lying on your side with pillows supporting you, rather than flat on your back. Now, I'd like to teach you a breathing technique that will help you clear the mucus from your chest. It's called the active cycle of breathing. Think of it like a gentle, controlled way of persuading your lungs to give up the mucus.
Will it hurt like when I try to cough normally?
It shouldn't hurt nearly as much because we're going to support your chest and do it in a much more gentle way. Let me show you the 3 parts of this technique. The first part is just gentle, relaxed breathing. Breathe in through your nose if you can and out through your mouth, letting your shoulders drop. Do this for about 30 seconds. This helps you relax and saves energy.
Okay, that doesn't sound too difficult.
Good. The second part is taking deeper breaths, not huge ones, just deeper than normal. Breathe in slowly through your nose. Hold it for 2 to 3 seconds, then breathe out slowly through your mouth. This helps get air behind the mucus to loosen it.
How many times should I do that?
About 3 to 4 deeper breaths, then go back to the gentle breathing. The third part is when we try to clear the mucus. But here's the key. We'll support your chest with a pillow or towel to reduce the pain. Hold this pillow firmly against your chest where it hurts. Now, take a deep breath in, and instead of a big, violent cough, try to make a huff sound, like you're steaming up a mirror. This is often more effective and less painful.
Let me try. Huffs. Oh, that did bring something up and it didn't hurt as much.
Excellent. You've got it. That's exactly what we want. The whole cycle should take about 10 to 15 minutes, and I'd like you to try it 4 to 5 times a day. The more you practice, the easier it becomes.
I can do that. Will someone check I'm doing it right?
Absolutely. I'll be back to see you tomorrow morning, and we'll practice it together again. The nurses can also help remind you, and your wife can learn it too if you'd like, so she can support you at home.
That would be helpful. She's been so worried about me.
It's natural for families to worry. Teaching her these techniques will help her feel more useful and less helpless too. Is there anything else you'd like to know or any concerns you have?
How long will it take to get better? I'm supposed to be looking after my grandchildren next week.
That's a lovely motivation to get better. Most people start feeling significantly better within 3 to 5 days with the right treatment. Whether you'll be well enough for the grandchildren depends on how quickly your body responds, but having something to look forward to often helps people recover faster. For now, focus on resting, using the breathing techniques, and taking the medications the doctors prescribe. Your body needs energy to fight this infection. I'll see you tomorrow, and we'll see how you're progressing.
Thank you so much. I feel much more hopeful now that I understand what's happening.
I'm so glad. Remember, you're not alone in this. We're all here to help you get better, and you've already shown you can do the breathing technique well. I'll see you tomorrow morning, and please ask the nurses to call me if you're worried about anything.